Hi, my dear patients. The most important thing to me, besides me doing a great job with your surgery, is that you have minimal discomfort. And so we're going to talk about your pain protocol. So the pain protocol is meant to avoid the use of opioids. And the pain protocol that I have prescribed for you has been shown to be equivalent to morphine when used correctly. Now, the only problem with this pain protocol is you should not use it if you are allergic to non-steroidal anti-inflammatories like Motrin, Advil, Anaprox, those types of medications, or if you're allergic to Tylenol. So if for any reason we've given you instructions to follow this and you have an allergy to those medications, then for some reason there was a miscommunication and you should not be doing this. Otherwise, if you can take both non-steroidal anti-inflammatories like Motrin and Tylenol, this is the bomb. And you need to start it immediately. And actually the instructions are to start it the day before. It may be too late that you didn't do that, but in general, I do ask that you take 3 doses of Motrin the day before your procedure. And that's so it turns off the water faucet of these little cytokines that your body makes in response to inflammation. And so your pain medication and post-operative pain control can actually be controlled starting the day before. However, if you did not do that, then we will start your pain protocol the day of the surgery. If you are IV sedated and you can take Motrin, I will give you a pain medication in your IV that is a non-steroidal, that is long-acting. So that's going to help you automatically. If you are not IV sedated, then you can preload yourself 1 hour prior to the appointment with 600 to 800 milligrams of Motrin, and that can be your first dose of non-steroidal. 1 hour after taking a dose of non-steroidal, you're going to take Tylenol. The highest dose Tylenol on the market is arthritis or what they call muscle soreness type of Tylenols. So these Tylenols are very, very effective and work extremely well for controlling pain. And so I generally advise them over the extra strength Tylenol. The patients that want to be extremely careful about this are people who have anything possibly wrong or compromised with their liver, because your liver is the way that Tylenol is metabolized. So you want to be very careful about that. But alternating this regimen every 8 hours of a non-steroidal, an hour later Tylenol, and following this regimen religiously for 2 to 3 days post-treatment will result in you coming back to me and telling me what a wonderful doctor I am because you had no pain. Please try to comply. I know it's hard. I'm the worst about taking medications on time. So set a reminder on your phone, a timer every 8 hours for it to go off to remind you to do this. And you will have a much better pain experience after your procedures. And remember, it's always, always better to take medications with a little something on your stomach if at all possible. This will avoid GI upset from the medications like Motrin and non-steroidals. If you take a prescription non-steroidal on a routine basis, something like meloxicam or Anaprox, you can substitute that prescription medication for over-the-counter Motrin. So discuss that with me. If there's any questions you have about this, please call me at 210-269-6498 or 210-616-0980. That's the office. Thank you.